respect for each other as well. So in other words, you want them to attend, to go into the scenario as if they're managing a real life patient. Okay? And then you review the logistic details. So you tell them, so you orient them in the room. No? So for example, I'll show you the rooms later. No? So for example, in the room you have this is the e-cart, this is where the blood pressure is, this is the monitor where you will see the vital signs of the patient, you have the stethoscope here, you have the medication cart here, etc. So that they know where they are, they know what to do, where to get what they need, okay? And then you also tell them that this is a safe space, they can make mistakes, and it's okay. No, so but they have to focus and be in the simulation zone already. Okay, so this is kind of a briefing, and then you also tell them that you ensure that everything that will happen in the simulation room will be confidential, and the video will be just for the debriefing purpose with the faculty. Okay, and then after that, you have the clinical scenario already. Okay, so this is where you have the assigned roles, the case flow. Okay, and so for the clinical scenario, the faculty designs the clinical scenario. So for this lecture, actually, I just wanted to walk you through this. No, but we, of course, as a simulation lab or in the simulation program of the UP College of Medicine, we teach our faculty this in workshops, in a week-long workshop, and we'll be offering such to other institutions in December. Okay, but basically, I just want to walk you through it. Now, so you design the scenario. If you're the faculty, so after we've trained the faculty, we teach them how to design a scenario, and we give them templates like this. No? So in the templates, you have the introduction, postpartum hemorrhage, what are the course objectives, who is your target audience? Are you targeting third-year medical students, clerks, or are you targeting interns? Okay, so what the target audience would be, for example, here it will be clerks or interns. Okay, and then we have their learning outcomes. What do you want them to be able to achieve? Accurate history, physical examination, recognize the signs and symptoms of postpartum hemorrhage, be able to diagnose and then be able to manage a patient who comes for bleeding. Okay, and then you will also have the scenario design. So this is like an overview of what you need. So what type of simulator do you need? Do you need a mid-fidelity mannequin, a high-fidelity mannequin? We'll go through that later, no? And then what do you need? Do you need a relative? Meron ba yung makulit na relative? We can get a patient, an actor to do that. And then the room layout, no? So what do you need? Do you need an emergency room setting? Do you need a ward setting? Did the bleeding happen after she delivered in the ward na? Or did she deliver outside or deliver at home and then she's coming in the emergency room? What equipment do you need? Okay, even yung ambient sounds in the ER, you can tell us what sounds you need. Maingay ba? Okay. And then what diagnostics will be done? And then para may synopsis lang of the scenario. So this is a 30-year-old, gravided to, etc. So this is what we need from you or the faculty. And then the clinical course for the scenario or how it will unfold. Para kang gumagawa ng script, no? So, kunyari, darating yung patient, 90/60, tachycardic. So, lalagay mo yon. So, vital signs, ano yung status? Do you want na naka-house dress siya, na may blood or the blanket na may blood para mas realistic, no? So, you tell us, no? So, in other words, you design the scenario as you want it to unfold, no? So, and then, so you see in the column, diba, so vital signs, the patient status, what learning objectives are you achieving, what would be the action or intervention. So in other words, hindi lang yung what is the state of the patient, you also will write here what actions you expect from the students. Like, for example, actions like they should be taking the vital signs, they should hook the patient to oxygen support, they should insert a line. So yun yung ilalagay mo. So we know also how to equip the room, no? And then, yung events will unfold. Internal examination, ano yung magiging dapat na findings nila para mape-prepare namin yung mannequin or the task trainer. And then, here, you'll see as it evolves, no? So, when they put the intervention, naglagay sila ng oxytocin, naglagay sila ng line, they gave medications. How do you want, so what do you expect to be the reaction of the mannequin? And we can do that for you, no? So, and then, kunyari in this clinical scenario, this is an actual scenario that we use, no? So in this scenario, nagtuloy-tuloy, no, nag-hypotension and then nag-cardiac arrest yung patient. So you want them, kasi the objective here is not just the postpartum hemorrhage identification, management, but also how to do ACLS, no? So you can also include that, and then until the end, no? So what do you want to achieve and what happens? So parang yung calibrated response, kung ano yung ina-expect mo na gagawin ng student, and pag hindi nagawa, ano yung pwede mangyari, pag nagawa, ano yung pwede mangyari. Okay? And then, so the conduct of the scenario, and then also the student evaluation. Is this a formative or a summative evaluation? And then, is this a prerequisite to the next level also? So everything in detail, no? So, but this is taught in a workshop for a faculty. And then they're also given the template so that it's easier for them, with prompts, so that they know, and it's easier for them to just fill it in, no? So according to the scenario they're doing. And then another aspect is, as I've said, when I say we will prepare it for you. We have simulation specialists. Ibig sabihin, simulation specialists, or we call them simulation technicians. And these are people who are trained to prepare everything for you, for the faculty, which means that, yun nga, pag-prepare ng simulators, pag-train ng patient actors, and as this is happening in real time, as the students are inside that room, attending to the patient bleeding, the simulation specialist would be with you behind a one-way mirror, so that you can help guide as to the response of the mannequin inside, as to what the interventions, the student interventions are being done, no? So as the expected interventions or unexpected interventions are being done, then you can have the calibrated response of the mannequin from behind that one-way mirror, no? So hindi katulad nung tayo nga, nung see one, do one, teach one, when we attend to patients in the emergency room, for example, our preceptors are behind us, no? Literally breathing down our neck, sabihin, ano, mali yan, hindi yan dapat, di ba? Walang ganon, kasi the faculty would be quietly behind the one-way mirror, so that they can observe, and calibrate what the students are doing. Okay? So I hope that's clear. And then, so I'll give you examples. No? So for example, shoulder dystocia. So ito ha. So kayo ma-shock dun sa mga pictures ko. But this is an actual picture of a patient na tawag natin shoulder dystocia. No? So she's diabetic. So her baby is 4.5 kilos. So usually pag ganun, lulusot yung head, pero the shoulders will not be able to go through the pelvis, no? So in other words, mas-stuck yung shoulder, no? So this is what we call shoulder dystocia. Okay, so I found myself in this situation, my 10th year of practice. She's a 35-year-old, pero fourth baby na niya, ha? But I didn't expect it because she's 5'6", fourth baby. So tested na yung pelvis, nanganak na siya. And then the previous babies were 3.2 kilos to 3.4 kilos, but this baby was around 3.6, and this happened, no? So it got stuck, no? So the shoulders got stuck, and so we teach our trainees several times. Sa lectures, we keep doing it. So at the time it happened to me, I kept remembering the lecture. I kept remembering watching my senior do it, but I've never had my own shoulder dystocia until my private practice and my 10th year of practice even. And so I was just replaying it in my mind how to do it. But now we can use simulation to do that, no? So to prepare them and for them to be able to do the drills repeatedly until they get it, okay? So these are the things that we use, that we do, no? So we can what we want is to free the posterior shoulder, no? So we flip it like this, no? So there are maneuvers that we do, no? So there's a parent training module for this, and we can do this in simulation using a mannequin, so that they can be taught how to, not just the skill, but also how to use teamwork, communication, and being being the captain of the ship, and being the one in charge as to how to mobilize the anesthesiologists, the nurses, the midwives, no? So this is an example of us doing the shoulder dystocia drill, and we're lucky that we have the simulator now that can do this, no? So in the simulator that we have, so we can program it in such a way that if the learner does not do the proper maneuvers, then the baby will not be delivered, no? So we can program it that dapat tama yung ginawang maneuver before the shoulder can be freed and the baby can be delivered, no? So this is an actual shoulder dystocia drill, and this is a scenario that happened. So in instances like this, we're able to teach team versus individual function. Emergencies can be rehearsed. What is unexpected can be practiced, and communication is emphasized, no? So when we did this with our residents, no, so we realized na natataranta pa rin sila, no, considering that they must have seen a real one already, but so teaching them, going through drills like this several times over and over again will make us equip them how to address emergencies like this, and how to practice them for what is unexpected. Okay, so this is an example of how we do team simulation, and it's also how we can do it with an entire interprofessional team, no? So we are in a university where we have nurses, where we have midwives, no? So we can actually train teams, no, to handle such cases, or even just a simple delivery, no? So how to practice or train them or simulate for interprofessional training, how to practice teamwork, communication, delineation of roles, no? So this is how we do it. So, okay, so at the UP College of Medicine Clinical Simulation Lab, we transformed rooms into real-life birthing suites, no, or even operating room settings. Ito yung sinasabi ko na this is a one-way mirror. This picture, this image shows you that this is a one-way mirror. So while the learners are inside, this is actually in the lab. We've converted one of our rooms as an operating room, and so we can practice them in terms of OR decorum, how to address, for example, is it a trauma patient or exploratory laparotomy? Where should they be standing? Proper decorum, para hindi sila sisigawan ng nurses pag, di ba, na-unsterile sila because, yun. So, and then what we do is we contextualized it, no? So, sabi ko nga sa inyo, this was our dream since 9 years ago, and so being a government institution, mapa-ano lang tayo, mapa-sidetrack lang tayo na being a government institution, this funding came from the Senate, no? So pag inisip mo, pag nakikinig nga ako ng balita ngayon, this is from the General Appropriations Act. So this is from the GAA, pero it was for later release. So we presented to the Senate in 2020, and we got our first funding middle of 2022 kasi pandemic nun, no? So even if we got approved in 2021 January, we got our first phase of the funding in July of 2022. So hindi ganun kadali. Parang what you're seeing now went through a long process, and it's not easy to get budget. Hindi kami parang DPWH. So we were able to get funding for this, but we're still continuing, no? Until now, we're still lobbying for funds, no, for operations. But okay, so I digress. So balik tayo. So this is, so from this side, so this is where the faculty is. Imagine kayong nasa kabilang side as faculty with the simulation specialist, no? So we are able to calibrate the response of the mannequin or on the other side, no, where the learners are. Okay, so and then we contextualize it so that pagpasok nila dun sa room na 'to, it is like how the PGH operating room is. In fact, we use the same OR lights, 'no? And then for a time, we also had a real anesthesia machine coming from PGH. We borrowed it so that yung room will be like the PGH operating room. Actually, mas bago. So yung mga bagong operating room. Okay? And then, this is another room in our sim lab. This is critical care setup, no? So we have the ventilator there, and then the one for the vital signs monitor, no? So, and this is where we train students for critical care naman, okay? And then so here, another view of this is for the birth simulation where, as I've said, this is our sim specialist, and actually dalawang sim specialists on the faculty is somewhere behind. And then this is where we watch what they do. And again, we calibrate the response of the mannequin from here. Okay. And then, so here, so I'll show you some pictures of the scenarios that we've done, some with interprofessional during their workshops. No? So for example, this is during a workshop with interprofessional training. So we have nurses here, doctors, so we have anesthesiologists, pediatricians, obstetrician, gynecologists, nurses and midwives. And the clinical scenario here was postpartum hemorrhage. Here, the scenario is retained placenta. Okay, here the scenario was a patient who came in for acute abdomen. Okay, so again, this is interprofessional training. Okay, so and then so after that, so we went through the pre-scenario learning activities, the pre-brief, and the clinical scenario proper, and showing you also the examples. Then we go to the debriefing. Okay, so the debriefing is where we have the facilitated reflection. So in all the training that we've attended, all the workshops we've attended on simulation, everybody is in unison and saying that this is where learning happens in the debriefing part. No, so this is the integral part of simulation, and where a clinical eventuality is planned and rehearsed, so to speak. No? And this is where learning happens. And I'll tell you why. No? So for example, so debriefing will allow the learners to explain, analyze, and synthesize information and emotional states. It's for them to improve their performance. Okay, so what happens is after the scenario is done, we put them in another room, a small room, where we can fit nga six students, no, at least. And then here you see the video, so we can play the video, so we can play it back to show them what they did. Okay, because sometimes even if like right after you get the reactions, no, so you will say, okay, so what do you think happened, how was it, diba? So first you get the reactions, and sometimes they tend to forget what they did, no, so it's better to also view it, no, view what happened again, and then you ask them. So the briefing helps to transform a simulation experience into learning through reflection. No, so we go through it. Okay, so what happens? So sample phrases would be what aspects were handled well and why. No, so and then what aspects do you want to change and why? And then you can also do advocacy inquiry. I'll discuss it later, no. And then you also say, I noticed, for example, one of them, for example, nagpanic. I noticed that you reacted this way. You may want to consider doing this, because so actually, if the scenario can be like 15 minutes, the debriefing can be can be actually an hour and a half. So this is where it's longer. Kaya it's also faculty intensive, because if before pag nagturo ka ng postpartum hemorrhage, you can just give a 30-minute to 45-minute lecture to a group of 30 students, for example. In simulation, those 30 students, you divide them into groups of 5, diba? So 6 times mo gagawin something that can actually in real time cost you like 2 hours, no? So dati yung 45 minutes, diba? So this time 12 hours mo yung gagawin. So mas matagal, mas madaming faculty yung kailangan mo. But, you know, they learn better, okay? So when when you debrief, no, so another method is what we call your advocacy inquiry. So the first time we learned about this, as teachers, di ba? Even if you want to be the kindest teacher, di ba minsan, sabi ko nga, sa Tagalog, ang sasabihin mo nga usually, di ba? Parang sasabihin mo, um, dapat kasi ang tama daw na way is I saw that for example that you panicked during the time that you saw the blood coming out of the vaginal canal. I'm concerned because of that you weren't able to attend to the patient who eventually went into hypotension or bumaksak yung blood pressure. So what was going on in your mind? 'Di ba? Dapat ganun daw para you go through it step by step. The student or the learner understands what happened and is able to tell you what was going on in her mind. So you're able to correct it. So that's advocacy inquiry. Sabi ko nga, kung sa Tagalog, and alam to nung ibang teachers, di ba? Ang sasabihin mo, sa Tagalog, ano yun eh, hindi ganun tayo kabait. Minsan sabihin natin, ano naman ang pumasok sa isip mo at ginawa mo to, di ba? So, in fact, in one workshop where we were practicing this, the situation was breast cancer patient. And instead of the right breast, syempre ano lang to theoretical situation, instead of the right breast being removed, it was the left breast, di ba? Pero gusto nung facilitator that we practice this, no? I saw that you removed the left breast instead of the right. I'm concerned because, pero di ba, sa totoong buhay, it's so hard to do that because, syempre, isipin mo, oh my gosh, natanggal mo yung left. So, di ba? But we have as facilitators, as educators, we have to learn to do this because this is how we should be debriefing our learners, whether they're students, trainees, or sometimes if you're higher position, these are even colleagues, no. So so um so yan, another table to show you how you should be debriefing, no? I saw, the observe. I think alam na alam mo to sa reasoning or concern, no? So I was concerned that this happened, and then help me understand how that happened, or I was wondering what your thoughts are. I'm curious how you felt about that. So that the student is able to reflect on what happened, and you're able to correct, and the student or the learner will now be able to process this, and the next time it happens or the next time such an encounter, such a case comes in bleeding, then they would be doing better. Okay, so in terms of debriefing, these are the performance domains. It can help with decision making, technical skills, communication, proper resource utilization, leadership, situational awareness, and of course, as I mentioned earlier, teamwork. No? So the clinical scenario that we've gone through is the best method, no, for doing the technical and non-technical skills. Okay, so but it is a lot of work, but it is, believe me, it is worth it. Okay. So next is assessment. When you use simulation for assessment, feedback, and validation. And most of you have done this, no? So sabi nga natin, minsan di lang natin alam na yun pala yun, pwede na pala, yun pala yung simulation. Hindi lang natin natawag formally yun, no? So this is how we do it, no? So when we do it for OSCEs, diba? When we rate them, if they're able to perform the skills, not perform the skills, we use it for both for students and even for trainees or even for diplomate exams, so for high stakes exam na. Sometimes it can make a difference between being able to practice already or not, no? So all these things can be used, no? So simulation can be used for these assessments, no? Whether high stakes evaluation already. Okay, so this is how we do it. So this is just your pelvic exam, for example, and then we also use this for even for higher order skills like ligation of arteries, no? So how we're able to do it, how they can demonstrate and evaluate them whether they can do it already. Here also the same, no? So we're showing how we do a hysterectomy, for example. Okay, so this is when we can use it for feedback and validation. Okay, now let's go to the applications in health professions education. What spectrum of simulation resources do we have? No, so let's go through it. So we have our task trainers. Ito yung task trainers. Ito yung arm. No, so kunyari you want to teach, like I showed you a picture earlier, how you do IV insertion. That's an arm, or the pelvis, or catheter insertion. No? So it's a pelvis with a penis, or a vulva, so you can insert it through the urethra. Okay, we have task trainers for abdominal examination, breast examination, and then we have mid to high fidelity simulators. No? So when we say fidelity, it's how close to real life it is. So pag high fidelity, it's as close to life as possible. So which means that high fidelity simulators can blink, breathe, no, can bleed. Yung all orifices niya, you can put, so you can put an NGT, you can put a catheter, and then yun nga, you can breathe, blink, yeah, you can talk. So we have that. So we have high fidelity simulators. Mid fidelity would be mannequins that may not necessarily blink or breathe, no, but enough to have orifices, for example, that you can insert catheters into. You can use it for let's say trauma situations, or and later I can show you also how we use a mid fidelity for training. Okay, now when we say standardized patients, this is hybrid simulation. I'll enlarge this picture to show you, like, for example, we can have a standardized patient. So these are patient actors. So when we say standardized patients, kaya ganun yun kasi they are trained, no? Hindi to yung parang dati na sabihin lang natin, and I'm guilty of that before, sabihin ko sa resident, oh, pretend nga na manganganak ka. Hindi na ganun, no? So this would be patient actors that are trained to give the correct response. Okay? And then, what we do when we say hybrid, kasi pag tinignan nyo to, no, so this is a patient actor, and then we have a task trainer attached to her, so that when the student or the learner examines her, hindi siya yung ma-examine, di ba? So this is a pelvic model that we put blood, so para siya nagbi-bleed, no? Pero so that why is hybrid simulation better? Because then when they examine the patient they can interact with the patient. Sasagot yung patient, and if the patient is in pain, then she will say that she's in pain. No, so it's better. So they can even learn how to address an anxious patient. So it's not just the interaction; it's also how to address patients who would have concerns, or relatives who would have concerns. No, so and they can do this while in a very toxic emergency room setting. Okay, so, and then we also have what we call tabletop simulation. I'll show you another picture of that in a while. Tabletop simulation is, I'll show you na nga lang now. So, this is tabletop simulation, or what we call visually enhanced medical simulation. So if you look here closely, this is just laminated paper, no? So you don't need a mannequin. So you can have laminated paper, and then you can have the interventions naka-laminate din. Kunyari, yung paddle for defibrillation, meron nandiyan lang naka-laminate lang. So you can just go through the interventions with the learners, no? Kunyari sasabihin mo, okay, nag-hypotension yung patient, nag-arrhythmia, so what do you do? Then they can use the laminated paper on the side of the laminated patient, so that because what your objective is for you to know whether they know what interventions to do, no? So you can use this, or we call it tabletop simulation, or visually enhanced medical simulation. Then the more we don't have this virtual reality, this is the more advanced already, no? And here you can use, or you can design software, no, with an IT specialist to be able to use virtual reality to train your learners, no? Okay. So those are the modalities. Okay. Now, but I want to say that when we didn't have these, no, so sabi ko nga, this is a dream we've had since 9 years ago, but and now we have some of this equipment. But before we had this, how are we doing? So this is when we go to um, how to do simulation in limited resources, no, with limited resources. So before we had this, we used to teach students back in 2015, 2016. We taught our students to do dilatation and effacement. Di ba? Ito nga ngayon yung ginagamit namin. Di ba? Maganda na. Pero nun, we taught our students to do dilatation and effacement using oranges. Kasi the big orange approximates the size of a fetal head. Okay? So, and then this is how we prepare, no? I prepared it yung 3 centimeters, no? So 3 centimeters dilated, 4 centimeters dilated, fully dilated, okay? And then the full range. So you can see here the full range from closed 1 cm, 2, 3, 4, 5, 6, ganyan. And you just have to calibrate the oranges, no? And then you put it in a sock, no? And then they are able to do an internal examination on a cervical model. And they examine and determine dilatation using this model. Okay. And then during the pandemic, some of you may have heard this lecture already, but I just wanted to include it so that you know that there are ways to teach with limited resources and in situations like the pandemic when we couldn't bring our students to the clinics because of safety, di ba? So we kept our students away from the very place where they would experience learning best. So we were doing online simulation, no? So, and we knew that how do we teach them skills, no? So it can't just be visual, just by AVPs. It can't be visual and auditory. They also have to we have to address the tactile aspect of learning. So we sent them kits, no? So we sent them kits, and each kit would have how to use how to do the pap smear using clay, cervix made out of clay, put it in the toilet paper core, and then we also have so we taught them that, and then we also sent them, no, just what you saw earlier, yung sponge, no, so for them to learn how to suture, how to repair yung episciorrhaphy, yung ibig sabihin yung cut in the vagina when we do deliveries. This is how we taught them, no? So we sent them kits. We got donations, no, for us to be able to send them kits. And the time we sent them to 181 students, whether they're in Manila or in the regions. I remember we sent to as far as yan na nga, in Taraga, in Tawi-Tawi. We had students who were there, no? So we sent it to them. And then we taught them online, no? So it was hard, no? So kasi but the time we were getting cameras and lights, no, from Shopee, so that we can teach them. Okay, so this is how we taught them before, skills demo, and then how to. So we used all tools that we can use for them to learn at the time, and the students were happy, no. So and they're now our residents na, no. So and it. We achieved our objective. Of course, we had limitations also, but we were able to teach even them. We still use this yellow sponge simulator. Kaya lang kumapal na ngayon. No? We use na nga now the car sponge. And we are in the process of designing a new one so that it will be mid-fidelity man lang. No? Kasi sponge lang to. But it actually simulates yung first layer repair and second degree repair, no? So ito kunyari yung anal sphincter, no? So if you see, no, so we're trying to simulate this, no, yung change of plane from the first layer to the second layer where the muscles are. Okay, so and then so this is what we're using now for simulation. And then we also now just last year we also started to teach them how to do an endometrial biopsy. So we realized that our interns didn't know how to do an endometrial biopsy kasi kumukonti rin yung patients, no? So hindi pala sila marunong. And then they're going to graduate already, hindi nila alam. So we realized that we have to teach them as early as third year. So this is what we did. So siyempre, yung task trainers na pelvis, yung uterus niya, wala naman siyang butas for us to be able to do a biopsy. And also because syempre if they scrape that pelvic model, mahal, di ba? So what we did, so we used papaya. So you can use, so we call it a hybrid simulator. We use a pelvic task trainer here and we put a papaya inside. And so if they do an endometrial biopsy using a curette, no, so yung parang pangkayod, literally, they're able to get tissue, no, which is the orange tissue or the pulp, the flesh of the papaya. Okay. And then if we're using a pipal is like parang mong i-aspirate, no? So doon ko na-realize na syempre if you're able to, yung scraping, no, with a curette, you can get the orange flesh of the papaya. But if you use a pipal to aspirate, we have to simulate the secretions, di ba? So and then dapat meron siyang tissue, 'di ba, when they aspirate. So we put in, pero mahal lang nito. Ngayon hindi na 'yung ginagamit namin. 'Yun ng Minute Maid. But you can use yung may pulp para when they aspirate, it's also realistic that they're able to get tissue from the papaya or the uterus. Okay? Okay, so in other words, you can use what is available, or you can be creative and think of ways where you can use these things, no? So you can use a sponge for suturing, you can use nga this one papaya for biopsies, you can use nga an orange, no? So there are other ways to design your low cost simulators. It doesn't have simulation is not about more expensive mannequins. As I've said, we're just lucky now that we got funding after 9 years, but we still use low cost simulators to teach our students. Okay. Now, the other applications is that aside from the simulation lab, you can also do in situ simulation. In situ simulation means that you do it where it happens. Like, for example, you want to teach emergency room skills, then you can conduct it in your own emergency room. The only reason it's more logistically harder is because syempre, kung may limited lang din yung beds nyo, tapos you use one bed pa for simulation, then that could be a problem in a very high traffic emergency room. But the advantage of it is you can train them where it happens. You don't need to contextualize it because you're already teaching them where the setting is, no? And we were able to do this nung time of COVID. Wala pa kaming lab nun. So every time before we handle a patient, for example, this is an in situ simulation of a patient, a COVID positive patient for surgery, no? And prior to the emergency surgery, so you can train all the healthcare workers involved, no? So we call it a huddle where you can train how they'll be moving, who goes first, who does this, the delineation of roles, and then how to keep everybody safe, no? The time nung ginagawa namin to in situ simulation, wala pang vaccine. We had a lot of unknowns about COVID. Yun yung time na nalagyan natin ng plastic lahat. Yun. So it's very important. It was in situ simulation because then you can do it just outside or in another operating room until everybody is briefed, and then you transfer to the real operating room where the COVID positive patient is. Okay. And then yung mobile simulation is where this is a dream pa lang din, where we hope to equip an ambulance, for example, where you can do mobile simulation, and we can now train people in the communities or train our healthcare workers or DTTB in the communities, no? Okay, so the applications of simulation-based education, not just in OB, but in healthcare professions, is when you can use, so which ones will you use? Now, do we use procedural simulation? Do we use simulated clinical scenarios? Do we do hybrid simulations? Then here you can see which ones would be good for which objective. Let's say you want to obviously, if you want to teach techniques and procedures, you will use procedural simulation. If you want to train clinical reasoning and patient management, then you can use a clinical scenario with a standardized patient, or what we call hybrid simulation. If you want team to test or teach teamwork and crisis management, of course, you want the clinical scenario there. So depending on what objective you have, you can use the modalities I presented. Okay, now let's go to the incorporating simulation in your instructional design. No? So I wanted kasi to give you an overview, no? So, but of course, all these things, designing a scenario, writing your procedural simulation checklist, integrating into the curriculum. These are all separate workshops, no? And this will take a long time. Of course, we don't expect you to be masters already after this lecture. We just want to give you an overview, and then so that you know the practical applications of simulation. But in terms of incorporating simulation in your instructional design, for example, then you start. So I'm going to go through this step by step. No? So first, you do your needs assessment. No? So is simulation needed in your curriculum? No? Can the objectives be achieved best by simulation? And I hope that in what I presented to you, you know that there are a lot of learning objectives that can be achieved best by simulation. Who are your learners? What year level? Are they medical students? Are they dental students? Are they nurses? No? Are they OT or PT students? How easy is it to organize simulation sessions for the group in question? And then, what educational domains will the simulation address? And then, how will this fit with the current or existing curriculum? No? So like, for example, we have medical schools asking us to train them for simulation. And because they're starting, then that's perfect. Diba? Kasi they haven't started, and you can already put in simulation in their curriculum. But most of us here would have existing curricula. So what we want is to how to integrate simulation in your existing curriculum. And with that, you want to also know what resources are needed. So, enough ba yung faculty mo? And then, the infrastructure or resources that are available. You don't need a sim lab. You may just have a sim room, no? So one place where we went for training in Adelaide, they started with just a very small room for simulation. Now they have a building, no? So because they've become sustainable and they earn from simulation when they offer it for high stakes exam, for example. So mga ganun. So mahabang storya pa yun. But I'm just saying that it can start very small, no? So what resources do you have? What funding sources can you have? No? Okay. And then, as I've said, parang the next few slides, which I showed you na earlier. So you have a comprehensive approach, beginning with defining or identifying your learning outcomes and matching the learning objectives to the method of simulation that you will do. I showed you this earlier, but I'm showing lang the learning objectives because in the columns, we just put the number, diba? So these are the learning objectives. And then we matched it to what kind of teaching learning strategy would we do, or what kind of simulation modality. Do we do a scenario run? Do we just do procedural simulation? So depending on the learning outcomes that you want and the learning objectives that you have, then you match it. No? So there. So that's why I told you earlier that it becomes a teaching learning strategy. Now, this slide is like a step-by-step as to how to integrate it into the curriculum, so what we call the curriculum integration framework. So just to go through it very quickly, so you plan it, so you develop a curriculum with the expected outcomes, and then determine which outcomes are best addressed using simulation. As I've said, you have an existing curriculum. Is it for medical school, nursing school? Is it for training? Is it for continuing medical education? And then you determine the outcomes that are best addressed using simulation. Are you going to, so do you want clinical skills? Do you want problem solving? Do you want team training? And then you put the logistics for faculty development. No, so don't forget that your greatest resource is your faculty, and you have to train them. You have to invest in faculty development and do workshops so that they will know how to how to design a scenario, how to do debriefing, how to use the modalities, no, according to the outcomes that you want, and then determine which modality can be used based on what's available muna, di ba? So, is this faculty facilitated? Is it self-directed? If you don't have simulators yet, you can use the standardized patients nga with just a task trainer, or you can design your own task trainers for procedural simulation. Design your low-cost simulators also. And then you establish how feedback will be supported because you need this, no? So whether it's verbal, it's written, it's the briefing, no? And then when you implement it, you now implement it using, so when we implement it, we do scenario runs first. So tinatry muna namin siya gawin with the faculty, with mock students, di ba? Or mock learners. And then we run it with our simulation specialist. Para ka ring nagre-rehearse bago mo gawin yung actual, di ba? So, and then you troubleshoot and adjust accordingly. So we do that for all the scenarios with pilot run or pilot test first bago namin implement. And then when you want the stakeholders to evaluate the simulation that you did. No? So you want to evaluate learner satisfaction, faculty satisfaction, and then you want to also assess whether the simulation had an impact in your evaluation of knowledge, skills, attitudes of your learners. Did you make a clinical impact? So all these things are important so that you know if your simulation actually worked. And then you revise accordingly. So based on the results of the evaluation, then you revise, and improve. No? And it's a continuous process. Okay. So last few slides, I'll just talk about how we use simulation in training and research. No? So this is an example of, so this one, if you remember, during COVID, so we also had pregnant patients who had severe COVID, especially during the Delta surge. So we designed the pillow. This is with a partnership with Uratex. No? So this is all free. No? So first, I don't know if some of you received yung proning pillow. So for the face nung COVID, Uratex, we designed that with Uratex, yung face pillow, para pag when you prone patients, they're able to, so these are patients in acute respiratory distress syndrome, and then we prone them. Ngayon, nagka-problema kami nung Delta surge because pregnant patients, when we prone them, syempre meron pang isa, di ba, yung gravid uterus. So unfortunately, we lost the patient, 29 weeks, we lost the patient and the baby because of severe COVID during the Delta surge. We proned her, but it's very difficult. The healthcare workers had a hard time because, of course, she's pregnant, and proning her had a lot of issues and a lot of logistical issues, and she was intubated. It was very hard to do it, and we lost the patient. So what we did was we designed this pillow with Uratex, and you can see that for this, so we used the face pillow, which is not in the picture, but we used it for the face, and then for the gravid uterus, we use this. No? So we use this pillow. So we designed this, we tested it kung soft enough, firm enough, and then we tested on real patients, no, real pregnant patients, so that they can tell us their comfort, etc. And then if you can see, di ba sa pag pregnant, we put a toco monitor, in monitor for the heartbeat of the baby and the uterine contractions. So we put in slots para ma-thread yung monitors habang nakadapa yung patient. Okay, so here you can see that So this is how the patient will be, no? So yung gravid uterus may dati yun to yung ginagawa lang, no? So yung ginagawa lang dati pillows lang ginagamit. Kaya nagkakaproblema kasi gumagalaw yung pillows. So what we did was, aside from the designing of the pillow, we also trained an interprofessional team on how to do it. So how to prone using the proning pillow that we had, for a patient who's awake. Okay? So, paano siya papadapain, na hindi siya nagiging anxious? Because remember, these are patients who already have a hard time breathing. Kasi nga, may COVID sila with acute respiratory distress syndrome. So, if they have a hard time breathing, they become very anxious na idadapak mo sila. So, we had to train the healthcare workers how to do it. So this is the research that we did, utilization of the training, simulation-based training on the using the pillow on patients, pregnant and obese patients with ARDS. Okay, and this is the team training that we did on an intubated patient or sedated patient. So we used a mannequin or mid-fidelity simulator. So hindi siya high fidelity. This is our old mannequin. Para talaga siyang mannequin lang ng department store. Pero it's heavy enough so that we can simulate the how to handle a patient and how many would be needed, how to communicate, who would delineation of roles, no? So we have our midwives, our institutional workers, our nurses, our residents and fellows, no, doing this. Okay, and then there. So training and debriefing was also done for them. Okay, so 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 almost tapos na. So we're happy to share with you that we've that I've shared with you what we've done, but we are still working, no? So we're still working to be able to fully integrate simulation in all year levels in our med school. And our next goal is for the interprofessional training that we'll be doing because being in a health sciences institution so that we can train others as well. And as I've said, starting this December, we're already training other SUCs and other institutions for simulation. Okay, so it's not just skills. We want to also teach soft skills, courage, calm courage, and compassion, no, in a structured, safe space that is our lab. No? And simulation is a teaching learning strategy which, if used carefully and thoughtfully, can be transformational. So, thank you very much for listening this afternoon, and I hope that you learned this afternoon. Thank you.
Thank you, Dr. Germar, for a very comprehensive session. Let us open the floor for question. May you raise your virtual hand so that we can recognize you, or you may type your questions at the chat box and we will read your questions.
Mukhang nag-iisip pa sila ng itatanong.
Any questions po?
Do you have questions po?
Ayun.
Ayan.
Doc, can we have a copy of your presentation daw po?
Send to Claire, no? So ano, and then we'll be posting also when our workshops would be for those interested.
Let me read the questions po in our chat box. Is endometrial biopsies, endometrial biopsy competence expected for primary physician?
Yes, Chris, no. So that's why we want to teach it to our third year students, no, so that because when presented with patients, no, so Chris is an OB. So with gynecologic, so with vaginal bleeding, and especially in the postmenopause or abnormal bleeding for patients with risk factors, we'd like them to be able to do an endometrial biopsy, and this is an office procedure, no, so it's something that can be done as part of primary healthcare also. Um, yes, we can include MVA also, Chris. But we'd like to teach them an easier one and cheaper kasi yung well, individual Bible. But I know that in some areas, the MVA is also readily available. So we can also teach them that. Sige, babasahin ko na lang, Claire. So, yes. Yes, Ina. I have good news for you, Ina. So, yes, it's hard, no, simulation technicians. In fact, if I can share our story, our simulation technicians are actually our medical school graduates because of, well, one, funding issues. So parang it's part of the return service agreement. So I'm able to tap them. Yun nga lang, medyo yung turnover would be fast. Kasi, syempre, they stay 1-2 years and then they leave, no? But yun yung nauna kong nakuha. So, for the others, simulation technician are the ones who are helping us with simulation. And wala siya talagang parang minimum qualifications, which means that in the areas where we went for training, di ba, EMS, no? So we met simulation technicians who were previously patient actors. Ang common lang sa kanila is the passion for simulation. So in other centers, meron silang science background, yung iba wala, no? So kasi talagang it's something that we can teach. Now, the good news that I'm saying is it will be announced, I think, this October. But we've partnered with TESDA. So TESDA will offer certificate courses and we'll be the ones in UP Manila to train them so that we can have simulation technicians who can be fielded, no? So ang goal namin is they'll be fielded all over the Philippines at hindi sila ma-equip para lang umalis. Kasi medyo ano rin siya high in demand even abroad because nga there are no real formal training institutions for simulation technicians. So this is a pilot thing that we're doing with TESDA. So ang maganda dito, they'll have TESDA certificate. So pati yung employability is being looked into, and we've already looked into the needs assessment. Talaga siyang kailangan, no? So we understand that mahirap talaga. So we need to train them and equip them so that they have proper training and hopefully the funding will follow for your institutions to be able to yung salary nila man nila, no? So, yun. So, actually, wala talagang educational background. So, now we're going to standardize at least the training, no? So, Ina. And then, ano ba ako na?
Thank you, ma'am. Ma'am, they're also asking if you can share some major struggles in using the simulation.
So what do you mean? Struggles namin sa ano? Well, ang number one struggle, aside from us as the administrator, of course, the number one struggle was funding and how we can have the resources available. Pero kung kunyari you're asking me as an academician naman, the greatest problem talaga is how to convince faculty to buy into simulation kasi as I've mentioned earlier, it takes a lot of time. It takes a lot of time and effort, no? So sabi ko nga, yung pwede mong i-lecture ng 45 minutes, for 30 students pa lang to ha, you already need to to use 12 hours. So, syempre, kung hindi kaya ng isang faculty, kunyari, we do it simultaneously or we do it in a span of 2 to 3 days, then you would at least need 2 to ideally 6 members of the faculty who would be willing to give you their time, no? So honestly, when I was convincing some younger members of faculty to join us in simulation, ang sabi nila sa akin, and they were very candid na, "Ma'am, bawat araw po na hindi po ako nakaklinik, ito yung nawawala sa akin." So yun yung greatest challenge, yung having the faculty buy into the simulation. Yun yung sa resources side, I mean the human resource side. And as mentioned, yung getting the simulation technicians, kasi hindi mo talaga rin siya kayang gawin mag-isa. Kung kunyari faculty lang, mas mahirap kasi you need a simulation technician. Kahit wala kang high fidelity simulators, you need a simulation technician to help you prepare yung mga gagamitin mo for simulation. And then, yun yung major struggle. Ano pa?
Ma'am, how do you address potential biases po during simulation-based assessment daw po?
Yun nga, so kunyari, for simulation-based assessments, what we need, hi Mark, is that we standardize it, no? So kunyari, as mentioned, kunyari yung checklists, you standardize it so that you don't have inter-rater bias or inter-rater variability, you pilot test it. Now, for scenarios naman, we also encourage our faculty to have yung scenarios that are designed already that any faculty could do it. And then also the debriefing exercise or the debriefing part would already have a guide for facilitators so that we can standardize what the students have, and this will eliminate the bias, no? Yes, wait, nakibasa eh. So, Mary Joy, so the training workshops will be in UP. Kasi so that we can have, so the design is that we have didactics in the first day, first 2 days, and then we have the workshops in the lab already.
So existing lab technicians in our university can enroll daw po.
Yes, Chris. Yes. So, tapos ang maganda nga dun, kasi nung una, we were thinking we will just do it alone, no? Pero, yun na nga, maganda rin na TESDA partnered with us already, and it went through a long process. Actually, so 1 year na din to. Kasi the MOA was signed in September, and then we just finished, no, going through, kasi marami rin pala silang process, no? So, we thought we just submit the curriculum, the modules, okay na. Yung pala, we have to go through a lot of steps with them kasi meron din silang process na follow. Kasi ang goal is, diba, they'll be certified nationally and they'll have a certification from TESDA, so which increases their employability.
Another question po, Doc. Doctor, based on our personal knowledge and experience for more than 3 decades, what is the most cost-effective program in our government should prioritize in our health system?
Siyempre, ang bias, no? Sabihin ko na. Tsaka, ngayon kasi budget season, Mark, no? So we've been lobbying for this, and we had to justify a lot of things. So sabi ko nga, when it happened, when we presented in 2020 during the pandemic, because we started planning for this 2016, pero the opportunity to present to the Senate was 2020. So where we discussed this with them. So I hope that's your question. So we discussed this with them, and yung catalyst was the pandemic kasi they realized that we do need a safe space where we can teach our healthcare professionals safely, no? But ngayon, ang priority, if yung isa naman ang sa intindi ko na question mo, actually the program that's being funded now, and that's my other hat naman in PhilHealth and health technology assessment, is what we're pushing for is yung for universal healthcare, di ba? So ano kasi yan mix, no? So parang intertwined siya. So for example, for cervical cancer, what we're doing is we're expanding the Z package para walang babayaran yung patients, no? So yung neoplastic diseases are the priority. Other priorities would be for kidney transplant, di ba? For bypass, may mga ganun kasi cardiovascular pa rin yung number one sa atin. So it's being prioritized naman now by the government, except that ang daming steps, no? So it's being prioritized by PhilHealth. Tapos yung sa health technology assessment part, we need to approve yung mga procedures based on evidence so that lahat yun mako-cover, no? Pati yung mga gamot na kailangan mako-cover. So yun talaga yung event, yung isa naman, no? So in the other aspect, UHC yung dapat priority. Yes, EMS. So yung sabi nga ni EMS, yung ibang technicians sila are the simulation actors and actresses before, tapos yung passion for simulation na ignite sa kanila, so they became simtech. So and they've been here long, no. So oo nga, Chris. Yes, Chris, no. So I'm sure you have the same problem in your institution. So ang dami na nating students. And buti nga kayo, Chris, private. So sa I'm sure there are people here from SUCs, 'di ba? Ang problema natin the plantilla items, no. So how can we demand our faculty to give more of their time if we cannot compensate them enough, no? So yun kasi. So kahit kasi may konting rooms lang tayo, Chris, and materials, if we have dedicated faculty, then we can do simulation. Yung technicians training, it will be announced kasi in October. So, I mean, the partnership with TESDA will be announced in October. So, we will be able to post, ano naman to eh, so siguro sa TESDA website, we will be, and siguro, I will ask na lang NTTC to help us. Kasi ang effective ng ano niya eh, advertising. So, we will ask NTTC to repost also our announcements for workshops and for this TESDA thing, no? Para nga makatulong kasi mas maganda yung reach ng NTTC eh.
Okay. Before we continue with, if there's another question, there are some comments that I'd like to read, that this webinar is very informative. They find it, wait, napakagaling po at nakakahabi at pag-deliver. Malaking tulong po ito para sa amin. They're thanking you, Doc Germar, for a very enlightenment. So, Divine, is there other questions?
Wala.
Thank you din ha. Thank you. You all inspire us to keep doing what we're doing. Actually, itong month na to is, as I've said, it's our anniversary. So we called it September. Papatawa lang. September. So meron kaming activities. Parang we'll end nga tomorrow. But we will, sabi nga namin, since we're offering our first workshop for outside institutions, ang tawag naman namin dun, December. Tumawa naman kayo.
Tumawa na ako. September tsaka December.
December, di ba?
JJ, merong nagre-request daw. Hindi ko alam kung nabasa mo to.
Yung slide?
Hindi,
Ah, ah.
yung template daw that you utilize for the
Yeah. So, sige. We can give a template. Pero attend the workshop.
Okay.
Is there any questions pa po?
Mukhang wala na.
Mukhang wala na po, Doc. Let's proceed to our certificate. Okay. Sige. share natin. Nakikita. We would like to award the Certificate of Appreciation to our speaker. Let me read the citation. National Teacher Training Center for the Health Professions, University of the Philippines, Manila, and Dr. Corazon Paulino Gonzalez Memorial Foundation Incorporated present the Certificate of Appreciation to Maria Julieta V. Germar, MD, DHPEd, for her invaluable contribution as speaker during the online monthly seminar on simulation that works, practical approaches for teaching and training given this 29th day of September 2025. Signed by Maria Elizabeth M. Grajeda, PhD, Associate Professor and Dean, and Erlene A. Sana, PhD, President, CPGMFI. Thank you very much again, Dr. Germar. And to give the closing remarks, may we call on our Dean, Dr. Maria Elizabeth M. Grajeda.
Thank you also.
Good afternoon. Thank you very much, JJ. Alam mo, pagka-simulation, si JJ agad ang unang pumapasok sa isip
Thank you.
nating lahat.
Thank you, Professor.
Thank you very much for that wonderful lecture, as always. I think based on the remarks of everybody, I'm sure that we all learned a lot from this session. Ni-represent niya talaga yung theme natin today, which is husay, as part of our Sikhay. Thank you to everybody who came. Blockbuster tayo ngayon. As in, punong-puno yung, muntik na ako hindi makapasok actually. Punong-puno po yung ating Zoom, and may spillover pa in YouTube. So thank you for everybody for coming this afternoon. Sa aming mga suki, salamat for always supporting our monthly seminar. So we hope that you gained a lot today, and sana ma-apply din natin in our own context. I know each of us would have different needs, no, and iba-iba ang ating mga resources that are available to us. But JG showed us a lot of different ways on how we can maximize our resources in terms of but still achieving yung objectives natin for using simulation, whether we use it for teaching or we use it for assessment. So thank you everybody for coming, and hope to see you again in November for our next monthly seminar. So thank you and see you soon.
Thank you.
Thanks, JJ.
Thank you. Thank you, everyone.
Claire,
Bye-bye.
nag-photo op na ba tayo?
Ay!
Nakalimutan. Photo opportunity,
Oo nga
Clara.
pala.
Photo.
Nakaalis na yung iba. Please open your videos po.